You feel your knee pain going up and down the stairs and wonder to yourself, is this arthritis? But you put it off in your mind for later for fear of needing a knee replacement surgery down the line. In this video, you'll learn science-backed ways to reduce your knee pain in just a few weeks without medications or surgery. In more detail, here's what you can expect to learn. First, we'll address the many different reasons for knee pain, and then we'll talk about the solutions for two specific kinds of knee pain. So here are the reasons for knee pain. Understand that there's more than one reason for knee pain. Knee pain is a symptom, not a diagnosis. So here are just a few of the reasons for knee pain. One is patellofemoral syndrome, ACL tears, MCL tears, meniscus tears, arthritis, and others. This specific video will discuss the knee pain that comes from both osteoarthritis as well as meniscus tears. Now, not all the strategies we'll talk about will apply to both, and where it applies to one but not another, I'll address that. So let's talk about the solutions for knee pain. This one applies only to osteoarthritis, but not meniscus tears. Everything else in this video applies to both. So one solution is called traction. It comes from the word distraction, and again, this is good for arthritis, but on meniscus tears, and that is when you're pulling two bones apart from each other. In other words, if the problem with osteoarthritis is the narrowing of the joint space, well, you can widen the joint space by mechanically pulling two bones apart. In the case of knee osteoarthritis, you can pull the shin bone apart from the thigh bone. So here's one study titled Mechanical Traction from Different Knee Joint Angles in Patients with Knee Osteoarthritis. And here are the results. It reduced pain by 24% in a matter of 1 to 3 weeks, and that's just when it's done by itself without any other interventions. It's even better when combined with strength training. Here's one study titled Strength Training Alone, Exercise Therapy Alone, and Exercise Therapy with Passive Manual Mobilization, each reduced pain and disability in people with knee osteoarthritis. And here were the results. It reduced pain by 69% when combined with strength training, so quite powerful. Now, how do you do it? What you need to know are several elements. First of all, the frequency. It should be done 3 to 5 days per week. Duration should be 10 to 15 minutes, and that can be either continuous or intermittent. You can pull for 20 seconds, relax for 10 seconds. Pull for 20 seconds, relax for 10 seconds. They seem to yield almost equally good results. The force should be you pull with about 20% of your body weight, and there is your exercise prescription for traction. Why does it work? Well, the most obvious reason is increased joint space. If arthritis is the narrowing of joint space, you manually increase it. And yes, it lasts beyond just the time that you're on your back. It also improves circulation within the joint because it allows more nutrients to flow into it. As well, it decreases inflammation, and there are minor improvements in proprioception or body awareness. Now, another form of exercise that's good for both osteoarthritis and meniscal tears is strength training. And here's a study titled Impact of Exercise Type and Dose on Pain and Disability in Knee Osteoarthritis. Here are the results. Strength training 3 times per week reduced pain by 68%. How often do you need to do it? Minimally, it should be done twice per week, and you have small reductions in joint pain. Optimally, 4 times per week, and you have more than a 50% reduction in joint pain. How many sets and repetitions? 2 to 3 sets of 8 to 12 repetitions. What about the exercises? For your knees specifically, you don't have to do all of these, but choose one for the front, one for the back. So one for the quads, one for the hamstrings. Squats are a very good exercise. So are knee extensions. So are one-legged deadlifts, and so are hamstring curls. If any of these exercises bother the knees, in other videos and articles, I'll discuss how can you modify simple exercises to make them beneficial to your knees without causing any undue knee pain. So how does strength training help decrease joint pain? There are a number of different ways. One is better joint stability. If two bones can't communicate with each other, then they're rubbing away more cartilage than necessary. But if they talk to each other better, then there is better stability and less rubbing away of cartilage, or if there's no cartilage, they rub up against each other less. Also, better body awareness. To perform new strength training exercises, you have to understand where is your body in space, and so it improves coordination. Also, strength training is anti-inflammatory, and it increases the pain threshold due to endorphin release. When you're strength training, your muscles are burning, and that increases your pain threshold. Cardio is also a form of exercise that's both good for osteoarthritis and meniscal tears. And here's a study titled Effectiveness of Exercise on Pain Intensity and Physical Function in Patients with Knee and Hip Osteoarthritis. Here were the results. Cardio reduced the pain of osteoarthritis by an average of 49%. So pretty good as a standalone therapy. How often do you do it? Minimally 2 days per week and optimally 3 or 4 days per week. You get higher reductions with greater frequency up to 4. In other words, 5 and 6 days per week don't improve pain any more than 3 or 4 days per week. What's the type? And the type doesn't seem to matter. Whether you're walking, cycling, swimming, elliptical, etc., it makes no difference. They're all equally effective, as long as whatever activity you choose doesn't bother the knees. The duration should be 25 to 60 minutes, and the intensity depends. If you are doing high intensity, then do short duration, 25 to 35 minutes. Or if you're doing low intensity, you can use long duration, 45 minutes or more. Now, how does cardio reduce joint pain? One, endorphins. Endorphins are pain-blocking chemicals released by the brain. They block pain. If you're doing low intensity, they start to go up at about an hour. If you're doing high intensity, they start to go up at about the 25-minute mark, and they last from 1 hour to several hours. Also, joint lubrication. By moving a joint around, you send synovial fluid to the joint. Also, there are minor improvements in body awareness, not as much as strength training or the exercises we're about to talk about, and better mental health. It helps you reduce the anxiety that comes from pain. And another form of training that's very helpful is something called proprioception training, or let's call it, for simple terms, body awareness training or coordination training. Coordination is which muscle fires with what force at what time. So force is only 1/3 of the equation. It's also the right muscle with the right timing. And so proprioception training helps reduce knee pain quickly and by over 40%. And by quickly, I mean in a matter of just a few weeks. Here's one way to do that, and that is balance exercises. I dive way deeper into how to do balance exercises in this video, which is about the 3 top osteoporosis balance exercises that will also work for osteoarthritis and meniscal tears. If you want, click on the link right now on your screen or in the description below.